Doctor, I understand that you have created a procedure and it's called the Z lift or a Z lift weaving. Can you share what that is and what it does?
Basically, most facelift procedures consist of tightening the skin and also tightening the tissues underneath the skin. The problem about the tissues underneath the skin, as we age, they get weaker and they're more inclined to stretch. So the old techniques of just sewing them together, you're sewing one bit of stretchy tissue to another bit of stretchy tissue, which is okay temporarily, but it'll continue to stretch. And it's not so long lasting. My idea was to use a non-absorbable suture stitch, if you like, and use it as a weave and to attach this really to the zygomatic arch, which is the arch we have on the side of our facial skeleton here. And then we weave the suture back and forth in this deeper layer so that it's not relying on simply the weak tissues to be held together by a stitch, but it's actually woven into a tight weave and everything is pulled back and suspended to the zygomatic arch.
So doctor, that is so interesting. So how does that, how long does that Z-lift last, and how much younger might a person look from having that procedure done?
Well, people always ask that question, how much younger? First of all, that varies, it depends on the individual, but it's common to say 10 years, and I think that's probably a reasonable average for this kind of surgery. And I think any surgery, any facelifting procedure will give you 10 years, but how long will it last is the other issue and the more important issue. And I do believe that this technique allows it to last much, much longer.